Moloney.
Here again, Minister, welcome into the House, and I welcome the opportunity to say a few words on the hospital services. I want at the outset to acknowledge the progress that has been made in the terms of the delivery of hospital services in recent times, and in particular in my own county. At long last, Kerry General Hospital in Tralee is now home to one of the finest A&E departments in the country, and it is really a wonderful facility for the patients and the staff alike. The old A&E is currently being converted into a new cardiac unit, and the new medical assessment unit is also working well and is taking the strain off the A&E. We also had the opening of the new West Kerry Community Hospital in Dingle, and earlier this week we had the transfer of patients from the old Community Hospital to a brand new facility in the town. So it is important to acknowledge the progress that has been made. However, I understand that one of the two newly appointed A&E consultants at Kerry General Hospital is in the process of leaving his post, and I would like an assurance from the Minister that he will be replaced ASAP. Though a lot of progress and reform has been made, I sometimes wonder why it still takes so long for some people to see a consultant in our public health services. An 83-year-old constituent of mine recently received a letter from Cork University Hospital advising her of an appointment to see an ophthalmologist a year and a half from now. Nothing can justify keeping somebody waiting that long for a relatively routine appointment like that. She will be 85 by the time she gets to see the consultant, and if she requires requires surgery or further medical intervention, how long more will she be waiting? At the moment in Kerry, the average waiting time for rheumatology is 3 years, and for neurology is 2 years. But you can't get an appointment with a neurologist if it's very urgent in 9 months. I have to point out, though, that in these departments they only have a visiting consultant, but these waiting times are not acceptable, and we still have more work to do in this regard. A major problem that we now seem to have is the shortage of junior doctors, or at least the inability to attract newly qualified doctors into our hospital services. Sadly, too many of our new graduates are going overseas to better paying conditions, and our health services are suffering as a result. Also, I would welcome your comments, Minister, on the fact that I heard on the radio the other day, and I hope I have this correct now, but you can correct me if I'm wrong, that of the 39 consultant posts advertised, that I believe only 2 or 3 have been filled. Because with the best will in the world, Minister, if we don't have the consultants, we cannot deal with the problems of waiting lists, etc. And I would like to raise one other matter with the Minister, and that is in relation to the long-stay facilities for the elderly and how it impacts on our acute hospital services. Last year alone, nearly 250,000 hospital bed days were lost due to delayed discharges. This so-called bed blockers phenomenon, even though it is a term I do not like using, it seems to imply that the patient is the problem rather than the system. I understand that according to the HSE data, that of the 119 public long-stay facilities in this country, only 10 will be fully compliant with HICWA standards post-2015 if there is no further investment in those facilities. The ESRI projects an additional requirement for 888 places per annum up to 2021 to meet the needs of the growing elderly population. The question I would ask is what steps are the Department of HSE taking to plan for the long-term care of our older population in light of recent statements that indicates that up to 38 million is required to have public long-stay facilities fully compliant with HICWA standards by 2015. It is one thing to have all the standards laid down by HICWA, and I sincerely welcome those standards and provisions, but it is another thing to put the necessary resources in place to allow those facilities to meet those requirements. This in turn would take major pressure off our acute hospital services. I also want to say that I welcome the calls made by the IMNO, the Irish Nurse and Midwife Organisations, and Nursing Homes Ireland for the establishment of a Department of Health-led forum on long-term residential care in this country. And I would just like to remind citizens that the reality that for the vast majority of people in this country, their interaction with our public hospital services and the staff that work in those hospitals is usually a very positive one. The bottleneck seems to remain in A&E, and I look forward to hearing more from the Minister about what further progress we can make in that area. I want to commend Professor Higgins on his report and look forward to the progress of the new and reform programme, which will hopefully deal with all or some of all of the issues I have outlined. And I do recognise, Minister, that you have done a lot of work to date in reforming the health services, and I realise it is not an easy task, and will continue to work with you as best I can on that matter.